So if you have epilepsy, there are certain medications that you should not take because they can trigger your seizures. And the most important medicine is over-the-counter cough medicine and flu or runny nose medications and sleeping aids. So the most important thing is that there are medications such as Tylenol PM, Advil PM, and sleeping aids. Those all medication contain some medicine called Benadryl. It is a first-generation antihistamine. It can trigger seizures and lower the seizure threshold. So one patient told me that every time he becomes sick, he will have a seizure. So I asked him what happens. He told me that he will become sick, could not sleep, then he will take Tylenol PM to help him go to sleep, and then the second day he will have a seizure. So what really happens is that those medications have some certain triggers that can lower the seizure threshold, and you should not take them, including NyQuil and other medications that are available over the counter. And if you need any antihistamines, the second generation antihistamines, those are not sedating and you can use them all safely. Other medication that can lower the seizure threshold and make seizures happen easier, there are the antibiotics. So antibiotics such as the penicillin, imipenem, meropenem, and the cephalosporins antibiotics, and the ciprofloxacin. Those medications are used commonly for UTI and other indications, so you should avoid them if you have infection, and you can use other medications. But if you don't have any other choice, then we weigh the risk and benefit, and sometimes we can do that under caution. Other medications that can lower the seizure thresholds are pain medications, especially tramadol. So tramadol, what it does, it will lower the seizure thresholds and make seizures happen easier. So you should avoid tramadol if you have epilepsy or have a seizure disorder. And then for your convenience, I put all those medications in a list that you can download and keep on handy for you to avoid any of those medications for seizures. Also, other medications that you should avoid, and some of them are not even medications, such as stimulants, that cocaine and amphetamines, and some over-the-counter things that we use to boost energy, such as Red Bull and Mountain Dew and 5-Hour Energy. All of those are having high concentrations of caffeine that can trigger seizures in some patients. So it is very important to be aware of all of those conditions so that you can avoid having seizures triggered. Antidepressant medications are considered safe in epilepsy and seizures, and we can use SSRI, SNRI, any antidepressant. And if you open the package, you will see that they can cause seizures, but those are all with excessive dosing and toxicity and should not be causing seizures on the normal doses that you take with your doctor. And if you have epilepsy and seizures, I'm sure that you have lots of questions about seizures and epilepsy control, and I put down one video that has all of your questions answered, so you can see this one, and see you in the next one.